What if everything you knew about health was wrong? My guest today spent 30 years as a practicing physician before asking that exact question. His name is Dr. Stephen Bezruchka, and he is Professor Emeritus at the University of Washington and the author of Born Sick in the USA, Improving the Health of a Nation. I'm your host, Kristi Slaughter. Stay with us. Thank you so much for being with us and bringing up a topic that I think is affecting almost every single one of us right now.
Thank you for having me. I think it affects every one of us, not just almost.
You have done so much research and work about not just healthcare systems, but the questions behind why we are where we are today. You had a different perspective. Talk to us about how you got into that and how you have maybe knowledge that some people don't have that are trying to do some of the research and work and problem solving that we need today.
So I became a doctor 1973, thinking it was the most important work you could do to improve health and so on. After working for some 20 years, I discovered that how long people lived in the United States was not that great. Here we were with such an amazing healthcare system with great technology, and yet our lives were shorter than those back then in some 20 plus other countries. And this just didn't compute to me. So I began to try to understand why, despite spending so much on healthcare, our health, that is how long we lived, lagged behind so many other countries. And as I delve into this, I came to realize that political choices we make really structure the health that we have. And among those political choices include how much income or wealth inequality we produce in a country. Turns out many studies say that the more inequality you have, the worse things are for society. Now, as I explored this in the 1990s, I came across more and more studies to validate this. And so I've spent the last 30 years trying to draw attention to the fact that we don't live healthy lives in this country, and the situation is getting far worse. I could go on to detail the specifics, but inequality is not good for us because it distracts us from focusing on what really matters to produce health. And the title of my book, Born Sick in the USA, a takeoff on Bruce Springsteen's song, highlights the importance of the early years. By the time we're born, a lot of how healthy we will be in later adulthood has already been cast.
Is that based on genetics, prenatal care? What types of things influence that, have you found in your research?
Well, prenatal care, it turns out, has a relatively little effect. What really influences the outcomes in early life are the stress that mothers face when they're pregnant and the stress in our society as a whole. Surveys show we're one of the most stressed countries in the world, and that probably doesn't surprise many listeners, but how can that be when we have so much wealth in this country and all of these devices that, at a push of a remote control button can do so much? We are highly stressed in large part because of the gap between the rich and the poor. That seems to condition everything. And so the political policies that we choose, such as the big, beautiful bill, are going to increase the gap between the rich and the poor and further worsen our health.
You mentioned that you got started as a doctor when you were a little bit younger, the 1960s. If we talk about policies and things like that, there was something in the book that stood out for me. And I'm just a detail-oriented person. I can't tell you, I haven't quantified it. You probably can. How many marketing ad campaigns there are in a given hour or a time block for a person who's consuming either something online or they're watching television. I was fascinated when I read in your book that medical marketing wasn't a thing in the 1960s or 70s. Practitioners did not advertise their services as a doctor based on ethics. Talk to us about why that was important or just not allowed at the time.
So back in the 60s, 70s, it was just considered unethical to try to market your services. And it wasn't until the profit motive entered into the medical industrial complex, a term that was coined about 1972 by Barbara Ehrenreich. Once we started chasing profits, then advertising became a very good way to do that. So it morphed in the 1980s to advertising for prescription drugs. And now we are bombarded by ads for various drugs all the time. And we're required to also list the side effects. And those are rattled by very, very quickly, and often ends, one of the side effects of the drug is death. That should scare people. What we found in the 1970s, drug detailing was done by attractive young women going to doctors' offices to tell them to prescribe this latest new drug. Once they realized that if you advertise to the consumers, sales increase, and the studies show that very dramatically. The former method of trying to inform doctors about new drugs was essentially gone. What happens then is that we consume roughly half of the world's pharmaceuticals. This is very, very effective. And we're one of only 2 countries in the world that allow direct-to-consumer drug advertising. A lot of these drugs that we are sold and take have significant side effects, as I mentioned, including death. So I began using the term medical harm some 30 years ago to speak of the harms that medical care could do. And so here we are today for a variety of reasons, living shorter, sicker lives. That's the hard part for people in this country to consider, namely, we are not that healthy as a society. We don't live as long as people in other countries. And one way to consider that, the oldest old person, the person with the most advanced age, is pretty well never in America. They usually hail from Japan or other countries. So that should be one way of recognizing that we really don't have good health in this country.
Well, that's interesting that you mentioned Asia. I've been working in the gluten-free sector doing consulting and CPGs since 2007 when I was diagnosed after decades of not understanding what was causing the root issues of my problem, or one of them. And I started looking here recently at the rest of the world and what the trends are as far as including food as part of this longevity medicine in some ways, preventative. And it looks like we're talking about how money comes into play. This could be a multi-billion-dollar industry. It doesn't seem to be that talked about here. I know there are pockets here in the United States, but it doesn't seem to be given as much focus as far as thinking in terms of longevity and quality of health, not just extension of life.
So we are sort of schooled to believe that personal behaviors, the food you eat, exercise you do, the things you don't do, really matter most for health. And I used to believe that. I was a vegetarian for years, and I exercised all the time. Those matter, but just not that much. And what really what changed my thinking was discovering that in the longest lived country, Japan, men smoke at much higher rates than they do in the United States. Among rich countries, we have about the lowest rates of men smoking of any country, and Japan has among the highest rates of men smoking. Well, if I told you that's the reason Japan's so healthy, namely they all smoke, you'd be wise to not believe anything else I said. But that's one example of a personal behavior that we feel is not good for you, that somehow doesn't seem to matter as much in Japan. And that requires you to explore all sorts of other things and to change your mind. Changing your mind is about the best way of discovering whether you still have one. For the dietary question, the longest-lived prefecture in Japan used to be Okinawa. And I had read that the diet in Okinawa was pork fat and noodles. Well, I went to Okinawa, and guess what I discovered? Markets were slabs of pork fat, and they prize Spam. They eat a lot of Spam. You know, there are American military bases in Okinawa, so they were exposed to Spam. When I went to people's homes there and in restaurants, that's what they ate, a lot of fat and noodles. So what was their secret? Their secret was a Japanese phrase, hari hachibu, stop eating when you're 80% full. In other words, it matters less what you eat than eating too much of it. So in Japan, for example, there's a metabo law in which employers are required to measure the waist circumference of their employees over age 35. And if they're too round, then the company is supposed to undertake a program to decrease the waist circumference. And Japan is one of the least obese countries in the world, and we can take the gold medal for being the most obese.
I cannot imagine here in the States an employee finding themselves having their waist circumference. We were talking about the importance of early childhood development, education, and what happens. How does that transition from a woman becoming pregnant and FMLA and things like that transpose into oftentimes women not being able to stay in the workforce and having to leave? What have you found in your research and your experience?
So, as you go from conception to death, what happens to you in the first 1,000 days after you're conceived, essentially up to your second birthday, that's the first 1,000 days, roughly half of your health as an adult has been programmed. That is, there are various developmental issues that go on, and these are something that you as an individual have no control over. So what happens, the parents supposedly have to provide for an optimal early life situation. But in the United States, with our high inequality, it causes a lot of stress for people, especially now our inequality is increasing vastly. And so mothers typically can't be with their infants, with their newborns, for very long. So the policies necessary for these are not to tell the family to be there for your child, for your infant, because, they have to go back to work to put food on the table. There are only 2 countries in the world that don't give a working woman who's pregnant paid time off after she has her baby as a national policy so she can be there with her newborn. The United States being one, and Papua New Guinea, half of a big island north of Australia, is the other. So we have our Family Medical Leave Act, the FMLA, you mentioned, passed in 1993, that gives a working woman who's worked for a company for a year or more 4 months of unpaid leave as a national policy. After that, you can fire her. Well, how many in today's America, how many families can afford to have a breadwinner, as women often are, off work for 4 months? They mostly go back to work in 2 or 3 weeks. I poll my students in the classes to see what their early life situations are, and only a few students from rich families can have their mothers there for any significant length of time. So what does that do? Well, World Health Organization recommends exclusive breastfeeding for 6 months. And the United States has very low rates of that happening for reasons that I mentioned. It's very hard to work, pump, and repeat, as the title of one book puts it, to breastfeed, to exclusively breastfeed your child. So what are we going to do? Let me frame how difficult or deadly the problem is. If we compare our health to the average of the other rich countries, the daily carnage is about 700 deaths a day occur in the United States that wouldn't occur if we had the average health of the other rich countries. So how can we operationalize that? Think of a fully loaded jumbo jet, the whole 350 people say. 700 deaths a day is equivalent to 2 fully loaded jumbo jets crashing every day. That's the carnage. Now, this results from the political choices we have made to not foster healthy early life and to create great inequality that stresses us out. And this carnage is invisible. That is, the people in those planes that are dying die from the usual diseases. The number 1 cause of death is heart disease. Number 2 is cancer. So we are talking about what people call structural violence or social murder, namely, we die from the structure we've chosen to have in our society, from the usual diseases. It's not like a real jumbo jet crashing that we can see. If we could, then we'd do something about it, but it's invisible.
We were talking about some of the implications of not having proper health care, adequate or accessibility. And I have not talked about this on the show, but I have been on both sides. I've had private health insurance, and then I have had government assistance. And you think you know until you know. There's nothing like life experience, right? You think you know what it's going to be like to be pregnant until you're pregnant. I think that there is or can be some blame, self-blame, and weight that people carry. And oftentimes it exhibits in ways of shame. And then that further can cause the issue. You had talked about stress and the implications of that, maybe even far outweighing some daily lifestyle, physical choices that we make. You've been in the medical field and you're also a professor. How does that shape the tapestry of the current climate that we're in right now?
So, to begin with, the United States is a very individualist society. Things happen to you because you work hard to get them. That's basically a myth, but that's what people believe. In a big economic gap society, you didn't achieve the American dream and become rich. So you blame yourself because you didn't try hard, and other people will put you down too. So the feelings you have are resignation, gee, I didn't do it. The ultimate is feeling ashamed that you failed in achieving the American dream. You have only yourself to blame. The government, the political system had nothing to do with it. At the same time, you value health care immensely. When people are asked what's the most important thing to make you healthy, they rank health care first and politics last. Well, the reality is politics matters most and healthcare matters least. It's very hard for me as a doctor. I practiced for so many decades thinking healthcare was really important, and to then come to realize it was much less important than I initially felt, and I could document that very, very well. So for the individual who feels healthcare is so important, it's become much more difficult to access. We find in rural areas, private equity funds are buying up hospitals and practices and basically running them into the ground because that will allow them to profit immensely. And so people feel deprived of access to health care, and they blame themselves for it, increasing the shame in the process. So it's a diabolical situation in this country. We don't have good health. We blame ourselves for it instead of the political situations we have chosen. And so what needs to be done is to begin by informing people that we're dead first. We die younger than so many other people in so many other countries, and that spending more money on health care is not going to solve this problem. It's a big challenge.
Dr. Bezruchka, you had mentioned earlier about your 20 years as a practicing physician, and then you started asking those questions, those life-altering, pivotal questions. And I just want to commend your courage. That was many decades ago. I think in my own life, when something just doesn't seem to add up quite right, I just have a nudge about it. And then I have the courage to step into that and really pull back the curtain. That's where passion, purpose, and lasting change can often come. Is there anything else? We've got just a couple minutes before I let you go. I'd love it if you give us your website and anything else that you would like to leave us with, maybe something that we could tangibly do as individuals that can make a difference.
Well, lots to say, but if we look at the geography of this country, on page 51 of Born Sick in the USA is a map of life expectancy, how long we live in U.S. counties. And there's almost a 30-year gap in life expectancy among counties. And you're in Bristol, Virginia, which is, I think, Washington County is nearby, and it has lower life expectancy than Virginia as a whole, and is close to Appalachia, which has some of the worst health outcomes in the country. So geography really matters. The longest lived state is Hawaii. Hawaii has a very sharing culture and less inequality. Virginia, not doing so well. So we can localize it and think of what's going on in Bristol, what are the political policies, how can I draw attention to Bristol not being as healthy as it could be, and to get people to recognize that it's systemic change that is needed. We want to improve health in our region, but the key thing is if we follow how long we live in the country as a whole and start getting that improving rather than declining, that will be good for all of us. We have to do what's going to benefit every one of us, and especially those of our children and our yet unborn grandchildren and great-grandchildren. It's going to take a while for our health improvements to take place once we pass legislation to improve our health.
Thank you so much for joining us today. And Dr. Stephen, let's go ahead and I'm going to spell your last name just so people can look you up. It's Bezruchka, Bezruchka. And the book is Born Sick in the USA, Improving the Health of a Nation. Thank you for joining us. I would love to have you back on anytime that you've got some updates. I know that this is something that you're working diligently on, and we'd love it if you would keep us up to date.
Would be happy to, yes. And my website, StephenBezruchka.com, has my previous book, Inequality Kills Us All. You can download the book for free, open source, and there's much more material on the topics I've been discussing. Thank you very much, Kristi, for having me.
Thank you so much for watching. If this conversation moved you, please like and subscribe. You can find out information about the books on the show and our guest in the description below. You can always visit me online at KristiSlaughter.com. Thanks for watching.